I'm going to have to continue working until the day I die to pay these bills off because I don't make that much anyway. I just don't see myself ever getting out from under it.
And maybe you can relate because just like this Fort Worth woman, there are nearly 1 in 4 Texans struggling with medical debt. And this crisis isn't just about credit scores, but one that often forces people to choose between their health and financial survival. Tonight, the CBS News Texas I-Team is taking a very hard look at a deal between the government and nonprofit hospitals that's supposed to help people with their medical bills. It's commonly called charity care, hospital charity care. We've got investigative reporter Brian New joining us right now. And Brian, I know this deal has come under scrutiny lately, and now there are state lawmakers down there in Austin going, wait a minute, what's going on here?
Yeah, so Nicole, the way the system is designed to work is the government gives nonprofit hospitals these massive tax breaks. Now, in return, the hospitals are supposed to use that money that they save from taxes to help patients who can't afford medical care. But for various reasons, we found patients who qualify for charity care don't always receive it. So instead of financial help, they're getting a bill.
When you're just trying to survive.
It was a year ago today that I was diagnosed with it and told that I had it.
Paying off medical debt may not be the top priority, but cancer patient Deborah Hernandez says it's been a stress.
It's a big stress. There's times that I'll wake up in the middle of the night and like, how am I ever going to get out from this debt?
When doctors told her she needed 14 rounds of chemotherapy, Hernandez told us she had to quit her job at the elementary school where she worked with special education students. This left her without a paycheck, relying solely on Social Security to cover her expenses.
I have to sit and think, who am I going to pay? I need to keep the lights on, I need to keep the water running, I need to keep the gas on. What do I do after that, And if the money runs out, it just runs out.
When we first spoke with Hernandez, she told us her medical bills had soared past $300,000. Medicare was covering much of it, but she still faced out-of-pocket expenses, including a $315 bill from Texas Health Harris Methodist Hospital in Fort Worth, a bill she says she simply couldn't afford to pay. So Hernandez, who has never asked for help before, faxed an application to the hospital for charity care. A few days later, the hospital gave her a call.
She says, where did you get this fax number? And I said, well, one of your employees gave it to me. Well, she should have done that, and now we're denying you.
Every year, Texas nonprofit hospitals receive over $1.8 billion in tax benefits. In return, the Texas Hospital Association says the state's 127 nonprofit hospitals provided $9.1 billion in 2022 in community benefits, including $576 million more in charity care than what hospitals say is the common industry standard. Texas is one of 5 states that sets a minimum community benefit requirement, and nearly all of Texas's nonprofit hospitals meet or exceed that requirement.
Texas hospitals go above and beyond to ensure their communities are taken care of.
This is something that the Texas Hospital Association highlights in its promotional videos.
We have one of the highest standards for charity care law in Texas. And even with the higher standard, Texas hospitals have exceeded that minimum.
The CBS News Texas I-Team reviewed more than a half dozen independent reports on charity care. Some found that Texas's nonprofit hospitals provide high levels of charity care, but others came to a different conclusion. They found Texas's nonprofit hospitals don't provide enough charity care.
They'll try to say that their laws are stringent, they're great, they hold us to a high standard, and they'll try to make it seem like everything's hunky-dory.
Yeah.
And I think that there's just a few researchers, including myself, that would want to challenge that.
Tanner Alef from the Paragon Health Institute has studied nonprofit hospital finances for years. He says the hospital's self-reported numbers can be misleading because what a hospital considers community benefit spending is not just helping patients with their bills. A community benefit can also mean funds for research, community outreach programs like vaccine clinics or educational campaigns that he says are really just marketing. A 2020 federal government audit highlighted how the law is unclear about what community benefit activities hospitals should engage in to justify their tax exemption. 5 years later, Congress still has not passed legislation to clarify.
So there's a huge kind of black box around charity care and community benefit with hospitals right now. And that's where I think a lot of folks here in Texas want to get to the heart too, is because we're hearing horror stories throughout the states about what's going on with nonprofits not living up to their charitable mission.
We are pleased to inform you that Texas Health Resources has approved your account for financial assistance.
For more than a year, Hernandez has been stressed about her unpaid medical bills. But then, just days after we reached out to Texas Health Harris Methodist Hospital, she received a letter. The hospital took a second look at her request for charity care and this time approved it.
I can actually go to sleep at night now, where I would lay awake at night, or I'd wake up at 2 o'clock in the morning and it was just that bill looming over my head because I didn't know how I was going to pay it. So yeah, that's a big relief.
There will be a hearing on Monday in the Texas House on a bill that would prevent hospitals from pursuing debt collections on any patient until the hospital verifies that that patient is not eligible for charity care. As it stands now, nonprofit hospitals in Texas are only required to post that they offer charity care by putting up a sign in the lobby and by taking out an ad once a year in the newspaper.